Ear infections are an uncomfortable situation to tackle. In today's video, I will be talking about ear infections, its symptoms, causes and how to prevent them. Just relax and watch till end. Ear infections normally go away on their own, but sometimes chronic ear infections stay longer and cause discomfort. Ear infections, also known as otitis media, occur when there is bacteria in the middle ear, which is the space behind the eardrum. There are a few common causes. 1. Bacterial or viral infections. Colds and sinus infections, which start in the upper respiratory system, can move to the middle ear. 2. Dysfunction of the eustachian tubes. The eustachian tubes connect the middle ear to the throat's back. These tubes have the potential to obstruct or malfunction, trapping fluids in the middle ear and producing an infection-friendly environment. 3. Due to the shorter and more horizontal nature of the eustachian tubes in children, bacteria are more likely to spread from the throat to the middle ear. So, how do you identify if you have a chronic ear infection? Depending on the severity and the individual age, ear infection symptoms might vary. These symptoms can either occur in one ear or both ears. Here are the common signs of ear infections. 1. Ear pain. Pain is frequently the most obvious symptom, especially in young children who may find it difficult to express the discomfort. 2. Fluid drainage. The affected ear may discharge a yellow, white, or red fluid. 3. Hearing loss. Inflammation and fluid accumulation can affect hearing. 4. Fever. A fever may develop, particularly in bacterial infections. 5. Irritability. Children may be more agitated or fussy as a result of the discomfort. 6. Sleeping problems. Earache can get worse when you're lying down, which can disturb your sleep. What happens if ear infection is not treated? Leaving ear infections untreated can lead to more complicated issues. It may cause irreparable damage to the eardrum and bone in the middle ear. Treatment depends on the cause and severity of the infection. Always consult a medical professional for proper diagnosis and treatment. Here are some general treatment. 1. Warm or cold compresses. Applying a warm, moist cloth to the affected ear can help relieve pain. Warm or cold compresses can help with pain to a great extent. Both ice packs and a warm compress can ease ear infection pain. Applying a warm, moist cloth to the affected ear can help relieve pain. 2. Pain reliever. Over-the-counter pain relievers like acetaminophen or ibuprofen can help alleviate discomfort. Pain relievers are just temporary pain manager. 3. Antibiotics. Bacterial infections are often treated with antibiotics. It's important to complete the full dose even if symptoms improve, to prevent antibiotic resistance. 4. Eardrops. If there's fluid drainage, your doctor might prescribe antibiotic eardrops. 5. Surgical drainage. In severe cases or recurrent infections, a doctor might recommend a minor surgical procedure to drain fluid from the middle ear. 6. Tubes. For chronic ear infections, especially in children, doctors might insert tiny tubes into the eardrums to help with fluid drainage. 7. Garlic oil. Garlic oil has natural anti-inflammatory and pain-relieving properties. People have been using it to treat ear infections and earaches for centuries. You can make garlic oil by using fresh garlic clove and olive oil or other carrier oil. Instructions. Peel and crush a few cloves of garlic, heat up a small amount of olive oil, just enough to cover the crushed garlic. Add the crushed garlic to the warm oil and let it steep for about 30 minutes. Strain the mixture to separate the garlic solids from the oil. Place a few drops of the garlic oil into the ear canal. If you like this video, give it a thumbs up, share and subscribe. Don't forget to click on the notification button so that you will be notified whenever I upload videos.